Hi, this is G.H. Glade for Coaching ADD. Recently, a client of mine asked the question, can PTSD symptoms exacerbate ADD? This is a person who got out of a difficult marriage and found that this was triggering of past trauma and abuse. And she noticed that her ADD suddenly wasn't as robust as it was before. So I decided to take a deeper dive into the subject. And sorting out the differences between PTSD and ADD is very complex. PTSD is somewhat overdiagnosed, but really, people take an all or nothing approach to this. PTSD is the result of the brain restructuring itself in reaction to severe trauma. This can be sexual assault, this can be exposure to war, and this can be observed trauma of others. PTSD affects our brain in a lot of ways. It actually changes the brain. The brain alarm system becomes oversensitized. Your amygdala triggers your alarm system. You experience a disturbing event, it causes a fear signal. Your prefrontal cortex normally is our brakes, and we judge what is or isn't a threat. The perfect storm. But rather than take an all or nothing approach to that diagnosis, I think, like most things, it exists on a continuum. People may have some of the symptoms. They may not have nightmares or hypervigilance or enhanced startle response, but still have that response to trauma. The difficulty with PTSD spectrum symptoms is that the brain perceives threat when really that threat isn't there, or at least not there to the extent that the previous trauma was. Is there overlap of symptoms? Absolutely. And it can make a differential diagnosis between the two very, very difficult. PTSD and ADD can be mistaken for one another. They both present with a similar symptom profile. Now, ADD has considerable symptom overlap. We find that people can have inattention and distraction, restlessness, impatience, impulsiveness, anger, sleep disturbances, poor memory, poor concentration, anxiety, depression, low self-esteem, addictions, shame, unwarranted guilt, avoidance behavior. And I'll talk about the interventions for PTSD and the most effective treatments. So which came first, PTSD or ADD? Well, ADD is a neurodevelopmental disorder, and you have it from childhood. But that being said, an ADD brain somewhat predisposes people to experience PTSD symptoms. People with ADD are more prone to high-risk behaviors. They often may self-medicate, leaving them more vulnerable to situations that can evoke PTSD. Teasing out the differences between these two can be really difficult because they overlap so much. The therapist or clinician really has to be a detective. And while people may come up positive for testing of ADD, PTSD symptoms may manifest as ADD. So the short answer is yes. Exposure to trauma can enhance symptoms of ADD, and triggers to that trauma can exacerbate those symptoms that are commonly associated with ADD. One of the things about PTSD is people create what is best described as a fear circuit. The part of the brain that is responsible for fight-flight, the amygdala, is sensitized with early exposure. And we have a process where the brain is actually changed. One normally experiences a trauma, and I'll give the example of veterans in trauma. One sees debris on the side of the road, and one thinks, oh my goodness, this is an IED, it's going to explode. And progressively seeing trash on the side of a road that doesn't explode, like when people come home, can lead to extinguishing this fear response. But for people who develop that fear circuitry, it persists. That extinction doesn't happen. And there's several therapies that are exposure therapies that are really helpful. Several therapies are shown to be more effective than others and have strong evidence. Prolonged exposure therapy teaches you how to gain control by facing negative feelings. It involves talking with your provider and doing some things that you've avoided since your trauma. Cognitive processing therapy teaches you to reframe your thoughts about trauma. It's a talk-oriented therapy where your negative thoughts are explored, and short writing assignments are a part of this. EMDR helps you process and make sense of trauma. It involves calling trauma to mind while attention to back and forth movement or sound. Group therapy is particularly effective. It provides a supportive environment where people can talk about and re-experience their trauma in a safe environment with people who really understand. There are several sorts of therapies that involve that exposure and desensitization. Do medications have a role? Absolutely they do. SSRIs can really knock down some of the symptoms of depression and anxiety. And there are 4 antidepressants, 3 SSRIs and 1 SNRI, that are particularly recommended for PTSD. These are Prozac, Zoloft, Paxil, and Effexor. The latter 2 are not my favorites as a clinician because they are really hard to come off of. Oftentimes people need help with anti-anxiety methods and medications. Sometimes the anxiety is overwhelming. There is a really interesting development that happened at the Seattle Veterans Hospital, and they noticed a correlation between reduction of PTSD symptoms with a blood pressure med called prazosin. This is often very useful for nightmares. The interesting part of this is that people in the Seattle area are very familiar with the use of this medication. But you go further away from Seattle and clinicians are less and less familiar. Of course, that implies that a person has enough blood pressure to withstand having something that will knock your blood pressure down. So this has been G.H. Glade with a quick dive into the relationship with PTSD and ADD. Yes, to recap, it sensitizes a person more to the effects of PTSD. When one has those ongoing triggers to symptomology and one removes those, symptoms of ADD can and will reduce. Can you have them together? Absolutely you can. PTSD can co-occur with almost anything. And we find that genetic pathway similar in terms of symptomology and predisposition. So if you found this helpful, please go ahead and subscribe. Tell other people about this presentation because, I bet you know other people who benefit from this. Take care until next time. This is G.H. Glade for Coaching ADD.